Good afternoon, everyone. Welcome. My name is Steve Porcaro, and today we'll be talking about tackling procrastination. Uh, it's a topic that's near and dear to my heart. Um, I'd like to say I'm an expert in procrastination. Uh, Unfortunately, I've had my share, so I've used some of these strategies we're going to discuss. And to jump right in, because I want to get everyone off in a reasonable time, very simple outline for today. Take a minute, talk about some of the housekeeping tips. I'll do a quick introduction for those of you who don't know me. I think there's a few people here on the call that we're connected on LinkedIn or we're associated with. We'll have our presentation, and then we'll, time permits, we'll take some Q&A and share some best strategies, best practices among the group. Big takeaway though, in terms of sharing information, I would like each of you to leave with one idea that you can incorporate, at least for yourself, maybe your organization, your team, your colleagues, co-workers today. And to me, if somebody sends me an email and says, hey, I used this tip last week or with my business and it helped me, then I know I've done some small bit in terms of helping people. So very simply, we'll jump right in. Did I go backwards? No, I did not. All right. So if you'll notice on the screen, for some people, there's a lot of different webinar software out there, and I want to make sure that everyone knows how to use the system. You'll notice up on the screen, you can use your audio, you can mute yourself, you can type a question if you have a question, or if you want to send a chat message out to the group. And throughout the presentation, if you feel like you have a question, please forward it to me and I'll have an opportunity to answer it when as we go through the presentation. Also, for some reason, if we get disconnected, and it does happen on occasion, I am using the GoToWebinar service. Sometimes the system reboots, sometimes there's a storm technology. Just call right back in and we'll get everyone up and running. The other thing, just in terms of professionalism, we're all professionals on the call. I just want to be on our best behavior. If someone asks a question, we just want to show respect to people, and when I answer questions, I'll do my best to answer things in a way that respects people's privacy going forward. And I think the other thing, in terms of housekeeping, if for some reason you have to jump off the call, your schedule, you have to run into a meeting, you have to jump off, some event comes up, not a problem. I'll be sending out the slide deck as well as this recording, and you can listen further on at your convenience. So I think that's it for housekeeping. In terms of a quick intro, in essence, I'm an executive coach and consultant. I've been doing this approximately 12 years. My background is medical devices, as I think a number of you on the call are. I come from orthopedics, basically trauma, sports medicine, reconstruction, DME, biologics, did some spine, podiatry, basically everything from the hand down. I had a small distributorship, had some specialty products, did field training, and before that, I spent 5 years in the operating room as a surgical tech, first assisting central supply. So I have a broad background, but about 12 years ago, I decided to take my business in a new direction and focus more on the organizational growth and development, and my background has been very helpful. So, and also I started some of these LinkedIn groups when LinkedIn, I was fortunate to get on when LinkedIn was up and coming, and I thought LinkedIn would be a good place for me to stay connected to people I worked with in the industry. But I think many people, if you've been on LinkedIn and social media for a while, it's really overwhelming with the amount of information you get. And I really just use it to stay in touch with my colleagues and associates going forward. But it's a great device, and we do talk about networking on our new member webinar, but we can talk about that more going forward. At the end of the day, my objective for today for this particular topic is really sharing some of the things that I've learned, that I've experienced over the years. And when we talk about procrastination, as I said, you know, on one hand, I don't want to say I'm an expert in procrastinating, but I do have some experience with it. And it's one of those things, how do we share that with people and say, yeah, there are certain things I procrastinate. Some things I think are normal for everybody. But when we look at the objectives, the big takeaway, I would like to share some strategies on managing ourselves versus time, because we really can't manage time. Another thing that's very helpful, learn to say no when appropriate. The other thing, thank you, Tom. The other thing that's very important, and I had to do this when I was in trauma and I was on a trauma call with a pager and a, you know, urgent versus important or non-urgent task. There are times when we need to prioritize, and this is always a struggle because we get information overload with technology. And if you're part of a team, if you're leading a team, and this may also may also be relevant at home with your family. One of the things that's interesting, some of the strategies when it comes to managing myself and procrastination works equally at home as it does out in the field. So we'll do that. And then one of the things, we've all heard about the 7 Ps of performance and proper planning. But when I think of time management, proper preparation and planning of priorities prevents personal procrastination. Good words to live by. Let's jump in and see if we can discuss some of the things that are working. So right up front, I want to ask a few questions. You can answer or raise your hand throughout the presentation. First question, have you ever kept some appointments but had to cancel others? If you think back, sometimes things happen. Are we putting things off? But I know historically, there are times I had to cancel some appointments and also cancel others. How about projects? Are there some projects you completed and others that are ongoing? I think historically there's a number of things, again, children, work, community, sometimes we get spread thin. And then when we start new projects and we haven't completed the old projects, what do? How do we start this? And there are times when I feel like I keep putting information in the pipeline, and there are times when I haven't been able to close the loop on some of these things. These are some of the common things that as professionals, again, you could be running a small business. If you're in outside sales, I'd like to think outside salespeople are small business owners. But if you're running into these on a regular basis, what's the long-term solution? Couple more challenges that I think we run into, and at least I have personally. Do you wake up at night or have trouble sleeping because you're thinking of the things that you need to do the next day, or you have to remember what to do? Again, it's happened to me in the past. Have you ever forgotten an appointment with a key customer or an anniversary of some type? Even a task, a to-do. And this is another big one. I think as time goes on, we can get a million balls up in the air. And the last one, fail to make business plans happen because you allow time obstructions to get in the way. And sometimes I have a million ideas, but I can't pull the trigger on all of them. So I had to step back and figure it out, what worked for me. And that's really what we're going to be talking about going forward. Does anyone have any other common challenges that they've run into? And again, we're all friends here, so if, don't think you're the only one, but anyone have something else that when they talk about challenges when it comes to time or managing themselves that they run into? All right, well, if you think of something and you want to share it with the group, feel free. So once we look at some of the common challenges, I think the next part, how do we make time management happen for us? Effective time management requires commitment, and we also have to have a commitment to that culture. Whether you're leading the team or part of the team, Elton shared a comment here about having to put out fires. Yeah, I think when I was in trauma, Elton, I felt like a fireman at times when I would get calls from customers, which was a good thing, but we were helping to settle some of those crises. And Scott has one, delivering bad news. Yeah, procrastinating, delivering bad news. Yeah, that's a whole nother topic, so hold on for that. But when we talk about making it happen, time is not numbers on a clock or passing from one moment to another. It's really a commitment. And we do various tasks because we're committed to them. We show up to our business, we go to appointments, we have our meals because we're committed. If we go to the gym, people, and I've been focusing on keeping myself in shape as much as possible, not only for business, but my personal life. I have 3 boys. I want to stay active. We go camping, we go hiking, but I'm the only tool I have for my success, so I have to be committed to that. As a culture, it's a little bit of a shift. And I think to Scott's point and Elton's point, sometimes we're focusing on being reactive versus being proactive. And if you think about having someone canceling an appointment, now I've had people cancel appointments, I've had people not show up for meetings and wondering, they said they were going to come, we said we were going to talk, I wonder what happened. When I tried to reschedule, they hemmed and hawed about rescheduling at another time. Most likely the problem was that they're not committed to the value of your appointment or your meeting with them. And it happens. There are times people think they want to talk to you, and then when it comes to talking, they're not really ready. The last thing is, if you're leading a team or you're part of a team or you're working for an organization, does your company have a culture of making things happen? We have to reinforce the value of not only the appointment, but we talk about professionalism, courtesy. Even if you meet with somebody and they say, you know what, Steve, I love your product, I love your services, but we're not ready to move ahead at this time, that's fine. That's a perfect example. But when people don't value your time, it sets a poor example, and some other people may see that as well and say, well, if they're going to do that, I'm going to do it as well. When we find people, whether it's our customers, our colleagues, our team, if they don't understand the difference between committing to a culture of change or self-management, it's going to end up going down the road in a direction where it's going to be unmanageable. And I've gotten there. When I remember, and again, not to get too personal, when my children were small and we were in the fire mode, putting out fires, diapers, feeding, we got a puppy at the same time, my wife still says to me, what were you thinking? Why did you get a puppy when the kids were small? And I said, well, honey, the boys need to grow up with a puppy. Doesn't every family have a puppy? It seemed like the thing to do at the time, but in retrospect, it was almost overwhelming. But setting an example now, learning from some of these I don't want to say mistakes, but learning moments allowed me to be more strategic with this culture of going forward. And this brings us to this next point, understanding this importance versus urgent, or this time matrix. And when we think of Stephen Covey, habit number 3, you might have heard about 7 Habits of Highly Effective People. Stephen Covey has a follow-up book called First Things First, and it talks about how successful, effective people set priorities. And again, in my personal life, we set priorities. Our children, our family comes first, if you have children, family, but there are certain things we need to take care of ourselves. When my customers called and there was an emergency add-on surgery, I took care of that surgery. If I had a routine scheduled appointment with somebody, I could reschedule that. For me, it was really focusing on balancing my relationships, the roles, and the activities. And I think that's where the pendulum, where we go from one extreme or part of the pendulum right back and forth, where does that, what's our boundaries, what's our corridor, what exactly does that look like for individuals? And again, in orthopedics in the trauma field, I had to take care of those customers who had an urgent emergency surgery, because that's what we were providing them in terms of service. And then this was the big aha moment for me. Things which matter most should not be at the mercy of those which matter least. And I want that to sink in. Take a moment to think about that. I know, and again, I'm sharing personal information, I'm a creature of habit, momentum, custom, tradition, and we develop these habits for better or worse. And until I understood the things that matter to me, the relationship, some of the roles, the hats I'm wearing, father, husband, scout leader, sales professional, consultant, whatever I was doing, things that mattered the most should not be at the mercy of those which matter the least. That was a big shift for me. And then the next step of this, focusing on the truly important and say no to the unimportant. And again, for those of you who are in sales or have been in sales or part of a team, saying no was a hard thing for me. I worked in the operating room. I was part of sports teams. I was part of surgical teams. I was part of the community. I wanted to say yes. Saying no was counterintuitive. But once I learned to say no, it was very empowering, and we're going to talk about that. So the next slide that I'm showing, and many of you have seen this, it's been out there for a while, we look at this matrix. What is this matrix and what does it mean? Again, we're not talking about time management, but you can use this slide. We're talking about managing ourselves, and for me, this is a skill that I had to learn. Instead of letting my business run me, I had to run my business. Instead of my day running me, I had to run my day. Now, some people actually use a format like this, where they'll put their to-dos, their task, in this type of matrix. Some people do this informally. I remember years ago having a day-timer planner on paper, and there was a column to mark off the matrix. I know most calendar programs have some type of indicator, high importance, low importance, medium importance. This concept has been out here for a long time, but sometimes it's good to step back and be reminded the fundamentals of this, because I know things go on, we get very busy. So very quickly, quadrant 1, We look at the urgent and the important. As Elton, excuse me, Elton said, putting out fires, getting calls from the operating room because we have surgery coming up, we need equipment, things that deadline driven projects, things that have a due date because other people are relying on that information. The not urgent but important is prevention. Again, one is proactive, one is reactive. What can we do to prevent some of these things from happening? Maybe going to the operating room and making sure they have their inventory in stock, making sure the physician and the nurses are trained on that new equipment, maybe building the relationship with strategic partners or people, influence groups. Planning was always a big thing, taking that time to plan. Again, as I've gone through this process, I've become more strategic and looking at things from a different perspective. Very important, but it gets pushed off to the side. So here's the thing that unfortunately I think we're running into, I know I have in some levels because of social media, right? We look at urgent but not important. Taming that email dragon, getting the interruptions with our text. I mean, text messaging is great, providing it doesn't go off on a regular basis. As much as we want to communicate, if we're doing things that are urgent, pressing deadlines, how much interruptions are we getting? I know some meetings, some organizations, meeting on a regular basis is great, but when it gets to the point where they're meeting versus implementing some of these actions, it really takes a lot of time, and some companies have to slow down because they schedule meetings. It's so easy to click on schedule a meeting and invite people, but it takes away sometimes from productivity. And then again, popular activities, there are things we do, exercise, hiking, whatever you're doing to stay in shape. And America has a obesity diabetic problem, right? So everyone's trying to stay healthy. It's important, may not be urgent, but it's something we want to look at going forward. And then the last quadrant, I think sometimes this is the part I know I've been pulled into, the not urgent and the not important part. Doing busy work, doing pleasant activities, and maybe focusing on trivial activities. In some ways, this is the area where I look at this, where I would go to recharge. For those of you who have experience riding horses or exercising, they talk about changing the gait or changing the pace. If you're going from one where you're putting out fires on a regular basis, I know there are times when I would come back from being out in the OR all day and fall back into this not urgent, not important work to kind of recharge my batteries. And this is where I had to be careful that it didn't turn into a habit. And that's one of the things that it's easy to do because time seems to go slowly in that area. So let's talk about some of the things we want to avoid going forward. And this is where I want to get some feedback and hear some of your experiences, because everyone has a unique background and a unique situation, but there is some commonality. These 7 key points, I think, cover the majority of some of the things that I've run into and that many others have. But again, I'd like to use this as a start of the discussion, not really the end. Number 1, avoiding overwhelming tasks, spending too much time on non-productive diversions, not learning from others' experiences, recreating that wheel, no time for contemplation. This is one of the, I would say, for me, some of the most common, but I know a lot of leaders and a lot of business owners, high level, they don't really have enough time for that creativity juices. Not saying no, another very freeing moment. Not delegating, and that, again, may not be possible for everyone, but delegating is another great way to avoid some of these things. And then the last one, not focusing on the future. So we're going to talk a little bit more about each one of these in detail. But if someone said to me, Steve, what are the 7 obstacles? Top 7, top 10, I would focus on these. And for each of you, you may have your own priorities, or maybe there's only 2 or 3 that would impact you. But let's talk about them, and then we'll swing back to that. So the first one, avoiding overwhelming tasks. To me, making a list, a to-do list, is paramount to success. If we don't schedule, if we don't have some type of system, we're going to have overlapping commitments. We're going to look at everything and say, sure, I can do it. Sure, I can do it. Sure, I can do it. And all of a sudden you look down, you have 3 things due at the same time. If we miss an office meeting, what happens to that, that business opportunity? If we miss a soccer game with the kids, how does that affect my personal life? Is that something that I need to make amends for? So one of the things that's very important is making a to-do list. When we talk about overwhelming tasks, we want to break the list down to smaller, day-to-day manageable to-do lists. They'll help you determine priorities, how you're going to handle them, when you're going to handle them, who's going to handle them. So let's talk a little bit more about how it works, because I know everyone here is doing it. You made time to be on the call. Thank you. You made the priority in a sense in saying, I want to be on this call, but you may all have had a different way to approach this. So when I look at this, I look at everything as, what is my goal, right? We talk about SMART goals. You might have heard the acronym: specific, measurable, attainable, realistic, and time-bound. For me, why is it important? Am I going to get some return on investment? Can I fit it into my schedule? Very simply. And then I create strategies to reach the goal. And most of these strategies will be conceptual rather than measurable. And for each strategy, you're going to create a basic action plan, and you're going to address the basic questions: the how, the when, who's going to make it happen. And at the end of the day, we need to have that to-do list, right? How do we make a to-do list? Years ago, as I mentioned, we used handwritten day timers. I was an early adopter of technology. I remember buying my first organizer. It was an HP 200LX. It was a little clam box device that ran, I think, DOS 1.0. And the reason why I bought it, because this contact management system called ACT, A-C-T, was just introduced. And I remember looking at this saying, man, this is going to solve all my problems. It's going to help me grow my business. Man, it's everything. And I thought I was all that in a bag of chips, because I had this little, at the time, this Palm Pilot type device. And then I moved to Palm Pilot, Trios, Blackberries, the list goes on. But at the end of the day, we're using some type of system to document our process. And for those of you who are in the operating room or out in the field, my surgeons had a to-do list, right? Every procedure they did, they had a plan. They had a pre-op, intra-op, and post-operative plan. Every healthcare professional, every business has one. I looked at that and said, how come I don't have one? I need it for my business. I need it for my life. So whether you write your notes down or you use some type of computer, now we have the iPads, our cell phones, our tablets. We have so many great tools to do this. There's no reason not to do this. The biggest thing here is implementing a system that works best for you. But let's look at why this is important. When we look at the benefits, and I can't emphasize the value of transferring everything down to a system and a process. Earlier when I talked about, does anyone have trouble sleeping at night? yes, I'll raise my hand. There were nights I laid in bed thinking, man, I have 1,000,001 things I need to do tomorrow. And I'd be laying in bed trying to organize it. When we write it down, it frees up my mind. I know that it's in a safe, secure spot. I don't have to go back. By simply clearing your mind and putting them down on paper or electronic documents, you'll find that your sleeping habits change for the better. And that was a big one. At the time, it was hard enough sleeping with my wife and the children. She was nursing. We had babies waking up. We had putting the dog out. There was a lot of activity going on in my house at night. Sleeping was not one of them, unfortunately. But for me, it seemed like a simple concept. But when I first started doing it, when I first got into sales from the operating room, it was one of these things that we talked about sales training, but we didn't talk about time management or procrastination. The biggest thing I ran into is, what is the first thing I need to do in my day? And preventing overlapping commitments and creating good habits, to me, was the best takeaway. So now, and I hate to say it, I'm like a technology geek, to the point that I don't want to say I'm plugged in, but I have access to my data, and it's available on my computer, on my desktop, on my laptop, mobile. Now I have my mind freed up to be creative and to focus on problem solving versus data researching for data and information. And I know a lot of you do that now, but I want to make sure as a group going forward that it's still a valuable concept. It's still important. The next thing we're going to talk about is too much non-productive diversion. I love technology. I love the internet, but guess what? There are times when I'll sit down for 5 minutes to look up something. Maybe I don't get the newspaper anymore, so I get most of my news online. I'll be reading an article, and before I know it, 15, 20 minutes has gone by. Or I'm having my cup of coffee, and geez, where did all the time go? When we think about things that are sucking time up, it's distracting to the point where we have to step back and truly be objective. When I had a newspaper, when you finished reading the articles, you folded the newspaper, you were done. On the internet, it keeps going. So looking at your surfing, web surfing habits, I know it's easy to do with our cell phones. Junk email or constant email may be challenging. One of the things we want to do is think about changing our habits. When are we reviewing our information? Can you set time aside, the morning, middle of the day, late afternoon, to respond to emails? And again, I know customer service is key, and I'm all about customer service, but at the same time, if you're working on a project, how much time is it taking you away from? Because I can tell you this, when a surgeon's in the middle of operating, unless it's a true emergency, that's what he's doing for the next 30, 60, 90, 120 minutes. Occasionally he'll get a phone call and it's a patient requirement, and they'll say, hey, Dr. So-and-so, one of your patients is out in the recovery room and they need some orders. You have to step back and put things in perspective. Text messaging. It's easy to say, look at it twice a day in a perfect world. I'm not going to lie to you. My wife will say, honey, on the way home, can you grab the kids? Can you grab milk? Can you grab bread? That's great. If it's from my wife, this is my key team members or my children. Of course, I'm going to take the text message. But there are some people who are texting on a regular basis. And if you're a sales professional working in the healthcare industry, you're not going to be able to do that in the operating room or in a procedure or if you're in a doctor's appointment. But it is something you want to step back at and say, am I spending a lot of time doing that? The other thing that I've been very guilty of, especially when I was out in the field, I didn't spend enough time in my office doing admin work. So over time, I had the messy desk syndrome. It wasn't messy in the sense that it was full of dust and dirt and stains. It was messy because it was disorganized. I knew where everything was, and I just knew I had to move it under one pile to another pile. But what happens is I realized if I took time, maybe one afternoon every 2 weeks, to spend an admin day and file everything, and this is where I started being more preventive. See, all right, here's another little personal note. My middle name is Philip, Stephen P. Porcaro. So that P, and my kids make fun of it. They say, Dad, how come your middle name changes a lot? Well, it used to be P for procrastinate. Now it's P for being preventive, or being patient, or being passionate. But now I'm trying to be proactive. And what happens is I shifted my habit because I didn't want to touch it multiple times. So being proactive, touching it once, saving yourself some time in the long run. Messy desk syndrome sometimes goes to messy car syndrome, which just makes everything that much worse if you're carrying samples. And then the last one that's been very helpful when it comes to non-productive diversion, non-emergency, non-business calls during the day. Again, if you have a young family, if you have, there are certain things you need to call during the day. You have a doctor's appointment, a dentist appointment, IRS, paying taxes, sure, without a doubt. But one of the things, because of technology, people can reach us all the time. And I think part of it is if you step back and you look at some of these bullet points, are there a couple things that you can do differently that might make a difference with some of the time that you're spending, that non-productive time, so to speak. Before we move on to the next slide, any other diversions or activities that anyone does that they can share that we can add to the list maybe for the next time we talk about this topic? You don't have to get personal like I do, but I'm trying to keep it professional, but sometimes I get personal. But if you think of another thing that comes up, feel free to share it with the group. All right, so the next one, not learning from others. And this was a big learning moment as well. And as professionals, I think sometimes we have to step back and say, how do we educate ourselves? As professionals, I know some of you go to meetings, some of you are reading journals, some of you are staying focused on what's happening through your company. When we attend seminars and conferences, we're learning what to do, what not to do. We may not subscribe to magazines, but you may go to websites now and get information. I think learning and sharing best practices is one of the key ways that we can learn not to make the same mistake. Sometimes I have to make it 2 or 3 times, but if someone else has done something that works, I'm going to borrow that. Learning from others, sidestepping challenges and failures is going to save you time, stress, and convenience. One of the great values of being part of a community or some professional development group or even within your company is that you share the best practices and things that you're learning on a regular basis. All right, so I'm going to take a break here for a minute. Elton just shared a good thought. I don't know if anyone else has run into this, but in terms of diversions, spending too much time with customers talking socially. All right, I'm raising my hand. That has happened to me. When you go to a good customer where you have a good relationship, and I've had a number of those over the years, it's like going back to your old, home week type of thing. You go into the OR lounge, you put your scrubs on, you're having lunch, and you're hanging out with everyone. That's great. And maybe you need to be there because you have doctors operating, or maybe you say it's a safe place because I don't have to go out in the field and get told no. But thank you, Alton. That's a great idea, a great reminder for that. So just going back, not learning from others. At this point in my life, and I just went through this with my son, we had to fix a screen door going out to the patio. And it was the first time he had to replace a screen. And I said, the great thing we can do, yeah, we can read the instructions, but now we can go on YouTube and see how people do it directly. So there's a lot of information out there, websites, communities, groups, where we can learn what works and what doesn't work. Number 4, no time for contemplation. Having an open door policy in many businesses, many teams, many organizations, and even at home has been the foundation, and it's been talked about in many textbooks, business manuals, journals, theories. But as an organization grows, what happens? It becomes a nemesis of time management, personal time. And the same thing happens at home as well. We want our children, we want our family, we want to have that open door policy, but if you're working on a project, how do we say no? One of the things you may want to do, if this is one of these things, and Elton, this kind of goes back to you, or the topic you brought up, right? This modified open door policy, maybe picking a time, Tuesday afternoons from 1 to 3, there's an open door policy, and maybe that's a good time. Once a week you may go out and kind of socialize. Some people, you know, doing happy hour or doing lunches is a modified open door policy. You don't want to close the open door policy. You want people to come to you, but if you're working on a project, it's really hard to get things done. A perfect example, at home, my wife is an artist, she's an illustrator, she does graphic design, so when she's working on projects and she says, honey, I'm going to my studio, I'll be there for a couple hours, my family and I have learned we can't really disturb mom unless there's something going on that we need to get her attention in an emergency. But she has an open door policy when she's not working on a project per se. Depending on where you are with your business, with your role, setting some limits to this open door policy may be one thing. I know a lot of small business owners run into that where they say, I want to be open to my team, but at the same time, they're coming in on a regular basis. So just setting some limits is a great way to set that. You're welcome, Elton. All right. The other thing about contemplation, if we don't give our time, our mind, time to recharge, this is where we get our creative juices to problem solving, to presentations, to overcoming some of these challenges. We need to leave time for our mind to be working on it. Sometimes you have a vision for your business, you have a vision for your life, and you may get it while you're walking, while you're in the shower, while you're exercising, while you're on vacation. For some people, having a cave, it can be a man cave, a woman cave, or just a bat cave, it doesn't matter what you call it. It has to be a place where you can go at home, or you can go on a hike. I go hiking a lot. Somewhere where you can go and there are few interruptions. For my wife, she goes to her studio. She'll go down there and she'll draw personally. That's where she spends time getting creative. But for some people, it's a place where they go and they can recharge those creative juices. There are some people, and you may know them, who actually do things throughout the week to recharge. Somebody who would go see a movie on a regular basis. I actually, when I'm on the treadmill, my wife likes music, boy, you guys are learning a lot about me personally, so that's not a bad thing. I just don't want you to think that I'm sharing all this with you as blackmail material, but my wife likes music. I like to watch videos. So sometimes watching an old movie, an inspiration movie, some type of movie that's energizing, when I get off the video, that allows me to get my juices flowing, and that gives me a mental cave. This is where you go and you can have some great ideas, and this is where you can get inspired and you let your mind recharge. After writing everything down on paper, I don't have to remember it because I know it's secure. Now I can focus on the things I need to do to recharge. So think about, what do you do to free up your mind to recharge, and what type of cave, sheltered, protected area where you can go to do that. Does anyone have a cave or something they do now that they can share with the group that they find very helpful? And again, you don't have to, if it's too personal, you don't have to share it, but if you have something you'd like to share, feel free to send it along. All right, the next one, this is, how do I say this? Of all the things that I've done, just saying no has been not only the most hardest, but the most rewarding. Many times we're creatures of habit, right? So, all right, again, guys, personal request. If you ever run into my wife on the street, please don't tell her I told you all this stuff. But my wife would be having dinner and the phone would ring and she'll get up and she'd answer the phone, and I'd say, honey, why are you getting the phone? Oh, it could be my mom, it could be my sister, it could be something. 9 times out of 10, it was a telemarketing person trying to sell her something. And I'll say, honey, just say no and hang up. And she goes, well, I don't want to be, rude, and I want to be polite. And I say, honey, I understand, but you can say no. This is your time. It's our dinner time with our family. So this is no kidding. It took about 10 years, but one day we were having dinner. She picked up the phone because her mom was in the hospital. And this was, I don't know if we had call waiting or it was just coming on back then, but they actually said, Mrs. Picard would like to talk to you about a credit card. And she said no. And when she said it, it was like this big rush of adrenaline, this big hurrah. And I said, honey, how did that feel? And she said, it felt really good. And the funny thing is, I said, you know, you've learned to say no to other people, but you say no to me all the time, and that wasn't hard. And she goes, no, I can say no to you all the time. So it's interesting how we say no to our children. You know, don't go out in the street. Don't play with the sharp knives. We say no to credit cards, people. But how do we say no to certain people who want our time and energy? And I think figuring out when to say no is another great way to help take some of those things off your plate where you're not overwhelmed. So I just want to go back to the last one when I asked about ideas about man caves, and Elton shared home office is his person cave, man or woman, I guess it doesn't matter, but your cave is your home office, and that's a great place to go and let your creative juices go. Thank you, Elton. All right, number 6, not saying no. For my wife, there was a big fear. She grew up, her father was very polite. You know, we don't want to confront people. Yet, it was very hard when people would cold call and say, hey, I'd like to talk to you. There's a sense of hurting someone's feelings, and for most people, we don't want to hurt people's feelings. And as sales professionals, and some of you are sales professionals, it's really hard, and this is where our upbringing, our habit, where we have to overcome that, take a deep breath, and say no. The interesting thing is, you can say no without actually saying the words no. And I think one of the things as professionals, we have to adjust our language. Again, if you think about children, we might not say no, but we may say, you know, that may not be a good idea to take that sharp stick and poke the dog, or it may not be a good idea to run out in the street going after that ball. So you don't have to say no, but what you can do is learn to decline or deflect, or maybe let me think about it and I'll get back to you. So whatever works for you, once people understand that you're not going to automatically say yes, everything shifts. You'll see that when you start shifting, it's not the end of the world. And some people, there's, you know, we want to be accepted. We want to get the approval from people. And by saying yes, it gives us that. But once you say no and you start that process, it's amazing how things will start to shift. And if any of you try this over the next few days, a few weeks, just saying no, send me a quick email and please let me know. Because there are times I've said no, and there are times I said yes, and I've never regretted saying no, but I've always regretted saying yes. To, you know, and again, because I want to help people out, but I've done it at my own expense. And at the end of the day, if I'm not there for myself, if I don't put myself first, we're not going to be able to take care of others. And as a caregiver, and what I mean is, if you're a parent, you have a spouse, you're taking care of parents. As a sales professional or a business owner, you may be taking care of your customers. We're a caregiver. And just like in the airlines, when they say put your oxygen mask on first before you put it on others, this is the same thing. No is the oxygen mask for us. All right. Number 6, not delegating. One of the biggest challenges we run into is taking on too much. For me, it's sometimes, you know, you've heard the saying, my eyes are bigger than my stomach. Well, sometimes I'll take on somebody will ask me to help out or to do something, and in my mind, oh, I can do that in an hour, I can do that in a day. Well, I've underestimated sometimes my ability or the scope of the project. Sometimes we have to step back and say, can I get some help? Can I get somebody to assist with this? Perfect example. I have 3 boys, as I mentioned, and one day we had to clean the garage out. So the funny part is we buy a new house, we move in, we have a 2-car garage that we've never parked in. Our garage has become our triage center for kids' toys, camping toys, tools, you name it, it ends up in the garage. But one day we actually had to clean it, you know, every couple of years, that, you know, whether we need it or not, let's clean the garage. So I asked my older son, I said, Ian, can you go clean the garage? Or can you help clean the garage? And he's like, oh yeah, sure. And he opened the door and I could see his shoulders just sag. Oh my gosh. I said, just go in there and put your toys away. And I'm looking behind, he opened the garage door and you can just see his shoulders sag. And when I said to him, I'll tell you what, if your brothers and I come in to help, would that make a difference? And all of a sudden, his shoulders said, yeah, I can do that. Sometimes if we take too much on, we get this emotional sagging of the shoulders. We have too much on our plate, and what happens is we're not able to handle, you know, Elton said, putting out fires. Sometimes we have to leave time in our day because we know things are going to come up. We have to figure out what our boundaries are, and the more people we have to help, whether it's a colleague, a coworker, an employee, teammate, whatever, is there something you can ask other people to help you with? Excuse me, one of the things, and again, I didn't want to impose on people, and I was afraid for many years, and it's only when I started realizing, again, different topic, but asking for help and kind of sharing the load, that we could be successful as individuals. The other thing that's very interesting, if you look at this graphic, and it's on here for a reason, there's a magnifying glass and it's showing where it's taking the rays of the sun and concentrating them down, where you get these warm, gentle rays, but once they're concentrated, it allows you to burn paper. When we look at our efforts, when they're focused and condensed, and we have people helping us, all of a sudden, sometimes those warm, gentle rays can get focused, and you can really accomplish a lot. So it's very interesting when we talk about delegation, pros and cons. Again, we have to wrap it up here soon, but good topic to think about. And the last bullet point is really not focusing on the future. I'm guilty of beating myself up for some of the mistakes I've made in the past. Maybe I should have done things differently. Some of it's easier said than done. Hindsight's 20/20. I mean, I can go on and on. But at the end of the day, we have to stop dwelling on the past and move forward. So when we think about, I usually don't repeat the same mistakes. I'm lucky that way. I make new mistakes. But what I try to do is change the process or the steps. What can I do different? How do I turn this into a learning moment? I need to focus on where I am today and focus on the future. So I think forgiving ourselves, moving forward, is something that we want to take it off our table. At some point, we have to move on. There's very few people I've met. Actually, I don't think there's anyone I've ever met that hasn't made a mistake or, excuse me, wish they have done something different. And then the last thing, when we summarize this up very quickly, our goal here is we want to work less, in a sense. We want to accomplish more, work harder, not smarter. We want to reduce the stress. We want to get better results. That's the whole reason why we're developing a new way to manage ourselves. In turn, will give us more time to do the things we want to. Stepping back, looking at how you're doing things, is really the first step in this whole process. Again, this is no different if you're going in and you're a consultative sales professional. Before you can offer a solution, what's going on here? What can I do to help? 7 key obstacles. You may have 7 different obstacles. You may have 3 key obstacles. There may be 1 key obstacle in your way. Figure out what that is and figure out what you need to do and what works for you to move forward. I think the new habits, and at the end of the day, when I look at all these things, it really is developing a new paradigm, a new shift, a new habit that you're going to incorporate to help you take control of your day, your business, however you want to look at it. You may only need to modify an existing habit or maybe go 180 degrees and do something totally different. I think one of the, and again, when I work with clients, for some people who are making big shifts, they say, I want to do something totally different. Well, if you haven't been working out, you're not going to go run a marathon. You're going to slowly, incrementally make some of those shifts. Put a plan in place and slowly go through that process. Start small and practice on a regular basis. It's interesting. We teach our children this. We teach our new employees this. We have to take the same advice we give them. Start small, build up some confidence, build up some experience, and then we can move things to that direction that we're heading. The next one is sometimes we have to trick ourselves to start the process. We have to think outside the box and say, what do I need to do to shift? And I know for me, combining the treadmill with watching video, there are times I'll watch educational videos, I'll listen to books on tape or a presentation. I can kill 2 birds with 1 stone, because I don't know if I like to multitask, but I like to maximize my time. Some things you can't, But if I'm on the treadmill, I can do that. So for me, having the technology now that I can kill two birds with one stone was very helpful. And then the last one is get feedback, whether it's from yourself, sit back and say, am I on track? Do you have a spouse or a partner? Do you have a colleague, a manager? Is there somebody that can give you feedback to help you stay on track as you're onboarding or ramping up? Again, none of these things are easy, quick. Some of them are simple. But at the end of the day, if you can just get back 5% of your time, 10% of your time, what would that mean to your life and to your business? I'm not saying you're going to get rid of procrastination or some of these challenges, but geez, 10%, 15, 20%, 5 minutes a day back times a week, it's 35 minutes times a month times a year. That's a lot of time you can get back. So I know it's the top of the hour. If some of you have to go, I appreciate you staying on the call. What I would like to do is, if you have time, we can definitely stay for a few Q&A. I'd love to chat if you can stay. If not, thank you for joining us. It's been a pleasure having you. But I'd like to open it up for some Q&A. If anyone would like to have some questions, anything I can share, or maybe you have some tips you'd like to share with the group. So before I forget, last summer's cave, this is the presidential range in Mount Washington, and I was on another range across. So Mount Washington is up here, it's about a mile high, and we spent a week backpacking from the range that I'm taking the picture along this path to the top of the mountain up here, and we came down. So I spent 7 days backpacking, and that was well, there was a cave, literally, we slept up here on the top of the mountain. So there was a small cave up there. But any questions, anything that you guys would like to throw out to the group? All right, I'm just making sure. Questions, comments? All right. Well, if you don't have any questions, a couple things. If we're not connected on LinkedIn and you'd like to connect, please send me an invitation. I'd love to stay in touch with you going forward. If I can be of any assistance regarding this topic, feel free to reach out to me. If not, I'll see you online. Thank you for coming. Have a great day, and I'll see you soon. Thank you, everyone. Thank you, Elton. All right, does anyone have any questions about this backpacking trip? That was a heck of a trip. We didn't really procrastinate much on that. All right, have a good day, everyone.